This is Ask the Expert. I'm John Burgess, and our expert today is Tom Henry, who's treasurer of the North Coast Association of Health Underwriters. And Tom, let's get to it. What are the pros and cons of the health legislation?
Well, I'll tell you what, I don't have anything good to say about it except for the fact that they're making the attempt. On the con side, the government's already heavily in debt. This is just going to add tremendously to that. There's nothing in there for tort reform, something we need very much. And it shifts the cost from the older people to the younger people by mandating that everybody buy insurance. Now, that sounds like an insurance agent's dream, mandating you buy insurance, right? But in fact, the younger people can ill afford it, and many of them choose to be uninsured.
Listening to you and talking about that and mandating, and you look at the auto insurance, but, doesn't government already do that, mandate that you have insurance?
Not the same. They build the roads, and as a condition of being able to drive on it, they make you buy insurance. Different deal.
Isn't there an obligation, I guess, on the part of government to cover the 46 million Americans who don't have health insurance?
Well, that's an interesting argument, but first of all, they're not all Americans. Some 10 million or 12 million are illegal aliens. 17.7 million people earn over $50,000 a year and choose not to be insured. And then some 16 million people remain. Many of them are just a signature away from insurance if they need it. They get into a Medicaid or a SHIP plan or something like that. So that leaves 10 to 15 million people who either cannot afford insurance or who cannot qualify. We should have a social network for that, paid by income taxes, not taxes on insurance companies and so on.
Tom, ultimately, what is your recommendation? What should be done back in D.C.?
Well, Americans buy more health care than any other country because, one, we can afford it, and two, we need it because of our health styles. We overeat, we smoke, and those things drive up costs. If we took better care of ourselves, claims would go down, and then premiums would follow.
Sounds simple.
It is.
It is simple, isn't it? All right. Tom, thanks very much.
You're welcome.
Find out more. You can go to northcoastahu.org.